workers were working near a pipeline at ground level in extremely hot and humid weather. While working, one of the workers, due to continuous exposure to heat and physical exertion, he felt dizzy and lost his balance. Noticing this, the second worker immediately rushed to support his coworker, preventing him from falling to the ground. The worker ran towards the nearby HSE officer in panic and said, "Sir, my team member has collapsed and is unconscious. Please come, he needs first aid." The safety officer instructed him to stay with his teammate. Safety officer immediately calls first aid team for the medical assistance. Doctor receives the call from safety officer, asks, "First aid, please go ahead." Safety officer, "Hello, first aid. One of our workers has fainted due to heat and he needs immediate first aid treatment." Doctor, "Okay, please tell me the exact location so we can proceed immediately." Safety officer, "Please come to the field area near the pipe rack. Our worker is lying unconscious there." Doctor, "Understood, we are coming immediately." Doctor along with his team immediately rushed towards the location. The doctor's team immediately rushes to the ambulance without delay. With all necessary medical equipment ready, they quickly depart for the location where the worker had collapsed due to heat stress. The ambulance moves swiftly towards the site through pipe rack. Location nearest to the unconscious worker. Access were made clear to prevent any obstructions in the path of ambulance. The ambulance reaches the location, where emergency rescue team is ready to assist for medical aid. Upon arrival at the pipe rack, the medical team steps out of the vehicle. Simultaneously, emergency rescue members spring into action, immediately deploying the stretcher and preparing it for transport. The medical team navigates the site, heading directly to the exact location where the worker lies unconscious. Without delay, the responders begin a comprehensive assessment of the worker's vital signs and physical condition. They work in tandem to administer immediate, life-saving first aid while initiating the necessary medical treatments required to stabilize the patient before extraction from the scene. Once the initial medical examination is thoroughly completed, with practiced precision, the team members grip the frame and lift the stretcher, avoiding any sudden jarring of the patient. As they approach vehicle, the team maintains a steady, rhythmic pace, keeping their eyes locked on the patient's vitals. They reach to the ambulance, where they are about to load the stretcher, and with a final, gentle push, they guide the worker into the safety of the mobile ICU. With the unconscious worker securely positioned and stabilized inside the vehicle, the team members firmly shut the rear doors, ensuring locking is fully engaged for transport. Once the perimeter is clear, the driver is directed to proceed immediately to the first aid center, maintaining a smooth and rapid pace to ensure the patient receives clinical care without further delay. As the ambulance comes to a smooth but rapid halt directly in front of the first aid center, the emergency response team springs into a synchronized maneuver. Without a moment's hesitation, members at the rear grip the handles and swing the back doors wide, locking them into place to clear the path. Two team members expertly slide the stretcher toward the edge, securing their grip. With a coordinated lift, they guide the unconscious worker out of the vehicle. The squad maneuvers the stretcher at the first aid center where prepared for advanced stabilization. At the first aid center, physician immediately initiates a comprehensive clinical assessment prioritizing the worker's vital signs. The medical team closely monitors body temperature, heart rate and blood pressure to determine the patient's condition. Recognizing the symptoms of thermal overexposure, they administers remedies which includes the administration of intravenous fluids for rapid rehydration and the use of cooling fans for reduction in body temperature. The medical staff remains vigilant, continuously tracking the patient's recovery to ensure a safe and effective stabilization process. Immediate head count initiated to check whether everyone assembled at assembly point. Heat stress, its symptoms and prevention discussed in Toolbox Talk.